Hello, my name is Jason Lindell, and I'm a certified prevention specialist with the Agency for Substance Abuse Prevention, ASAP for short, located in Oxford, Alabama. Much like the demographics of our county, our agency is comprised of a very diverse staff of 8. Here at ASAP, we are dedicated to strengthening community awareness through the substance misuse education and prevention services to individuals, schools, industry, affected individuals and families residing in both Calhoun and Cleveland counties. We were founded in 1973, formerly known as the Regional Alcoholism Council, and in 1987 became the Agency for Substance Abuse Prevention. Today, ASAP provides substance misuse prevention education and intervention services to schools, community centers, boys and girls clubs, industries, churches, and a variety of other organizations and institutions throughout the community. It is my pleasure to introduce you to our State of the Prevention Address. This will be done annually to keep the community informed about the current issues we are facing from year to year. I want to talk to you about the present issues and trends we are facing in the substance misuse community on the local level. The issues that are associated with alcohol and other drug misuse are present within Calhoun and Cleveland counties and have caused an enormous amount of damage in both communities. This is something that, if not addressed appropriately, will only get worse and cost more lives. In 2017, Alabama had the highest opioid prescription rate in the country, nearly twice as high as the national average according to the National Institute of Health in 2019. In 2017, the highest rates of all drug-related deaths occurred in the Northern Eastern District. Jefferson, Blount, St. Clair, Calhoun, Etowah, and DeKalb counties, according to Alabama Department of Health in 2020. According to the Alabama Department of Public Health in 2020, the number of fentanyl-related overdose deaths are increasing faster than any other illicit or prescribed drug. In 2016, Cleveland County had an opioid prescription rate of 44.2 for every 100 people, according to the Center for Disease Control in 2020. Substance use disorder, also known as drug misuse, is a process that attempts to prevent the onset of substance use or limit the development of problems associated with using psychoactive substance. Examples include alcohol, all tobacco-related products, marijuana, inhalants, explicit and synthetic drugs, and of course, opioids. Prevention efforts may focus on the individual or their surroundings. At our agency, we focus on a few different ways to get information to our shareholders in the community. At ASAP, we utilize different strategies to help keep the community informed. Though the agency implements numerous strategies amongst the 4 different grants we have received, 2020 was a year like no other. The COVID-19 pandemic has negatively impacted our local community, and as a result, the resources citizens usually have access to are now extremely limited or not available at all. In fact, COVID-19 contributed to the overdose deaths in Calhoun County, and as a result, the numbers have more than doubled in 2020. One of the first things ASAP did when the pandemic hit was to donate a total of $6,000 to local charities in Calhoun and Cleveland counties that provide food, clothing, and shelter to those in need. Furthermore, ASAP continued to inform the community by passing out prevention literature to feeding station and public housing communities following all CDC guidelines. The concept known as environmental prevention focuses on changing community conditions or policies so the availability of substances is reduced as well as the demand. One of the biggest ways ASAP does this is by implementing the National Prescription Drug Take-Back Days, where we safely collect unused and/or expired drugs. This event is held twice a year in the spring and fall. We now have 4 locations that include Anniston, Oxford, Jacksonville, and Heflin for those individuals in Cleveland County. The take-back in April 2020 was canceled due to COVID-19, but the one held on October 24th generated 1,244 pounds of unused and expired drugs. ASAP was able to secure an overdose death prevention pill bottle. The bottle is a 6 foot tall by 7 foot long visual aid that is a constant reminder of the opioid crisis we face in our community. When you walk up to the bottle, you will find different resources such as prevention, counseling, and treatment services written on the bottle, along with their contact information. The bottle has been displayed in different areas throughout Calhoun County. ASAP was able to partner with the local coroner, Pat Brown, and district attorney, Brian McVeigh, to get updated information from the EDRS system. The EDRS system, which stands for Electronic Death Registry System, helps us to get current information on overdose deaths in Calhoun County. We can take the data and focus our resources on areas that have a high death rates due to opioid overdose. During the COVID-19 pandemic, we're constantly trying to keep the community engaged and informed while following all CDC protocols. Our creative thinking allowed us to come up with a Recovery Rock search. National Recovery Month is a national observance held every September to educate Americans that substance use treatment and mental health services can enable those with mental health and substance use disorders to live healthy and rewarding lives. The event ran up until December 31st, 2020, and included hiding 100 rocks through various cities in Calhoun County. Out of the 100, 10 were prize rocks, and the person who found these special prize rocks brought them in exchange for a prize. The prizes included donations from Calhoun County business owners and restaurants. Over the past year, we have worked to have a permanent drop box put on the campus of Jacksonville State University. This will be the second drop box we have put in. The first was in 2019 at Downey Drug in Welborn, Alabama. Their purpose makes it possible for people to dispose of their old, expired, or unused prescription drugs quickly and conveniently. Another project we were able to utilize is a monthly podcast that discusses national topics about substance misuse. The podcast was launched on October 1st, 2020, and has covered topics such as tobacco, neonatal abstinence syndrome, HIV, substance misuse recovery, and other various pertinent topics. One of my favorite strategies that we implement here at ASAP is the school-based prevention programs. There are a number of school-based prevention programs and classes that aim to educate children and families about the harms of substance misuse. We implement a few different curriculums in our school-based prevention programs. One curriculum being Too Good for Drugs by the Mendez Foundation. It is an evidence-based program to help build awareness of healthy choices and resist unhealthy behaviors. Smart Moves, Smart Choices is a national awareness program designed to inform parents, teens, and educators about the risk of teen prescription drug misuse and substance use disorder, and empower them to address the serious problem. The program encourages parents and relatives to monitor their medicine cabinets and to have open and honest conversations with their children. The real impact we make in the school-based programs are the relationships we make. I am constantly blown away with the stories I hear about these kids' situation. I have daily conversations about relatives of these children who misuse drugs or have died because of them. At the end of July 2020, we did a back-to-school rally for all school-age children. Our theme was Stay Cool, Stay in School, and we were able to pass out school materials, prevention-related materials, and ice cream to different communities within Calhoun County. We had a great turnout for this event, and of course, the ice cream was a huge hit with the kids. Community-based prevention programs work at the community level with civic, religious, law enforcement, and other government organizations to enhance anti-drug norms and pro-social behaviors. One of the ways ASAP helps the community is with our Opioid Roundtable event. It is put on with the help of different organizations in the community, such as nurses, prevention professionals, treatment, and rehab. In March of 2020, we were able to hold our Opioid Roundtable in person and had an excellent turnout. This year's Opioid Roundtable will be held Tuesday, March 2nd from 6 p.m. to 8 p.m. will be utilized on a virtual platform only. People included on the roundtables in the past have been doctors, coroners, law enforcement, and key speakers such as the assistant attorney in the Northern District of Alabama. Different guest speakers come and speak to members of the community in order to engage and educate local community members about opioid use and misuse. ASAP is part of the Children's Policy Council, CPC, which reviews the needs of children in their communities and how local agencies and departments can work together more effectively and efficiently to serve the children in their area. It is led by juvenile court judge Peggy Miller Locker and includes people from many different organizations, helping to make a difference in these kids' lives. We also worked this past year with the CPC to help them become a 501c3. I personally sit on an executive board of Sparrow Song, which will provide a safe haven for newborns experiencing crisis due to drug withdrawal or the need for immediate family intervention. The Sparrow Song is in the initial stages of development, which has unfortunately been slowed by COVID-19, with plans on becoming a 501c3 organization. We will be the first neonatal crisis center in the Southeast. The Sparrow Song will be operated in Oxford, Alabama, located in Calhoun County. We are part of the Anniston Fatherhood Initiative, which mentors young men ages 8 to 21 in Calhoun County. A group of male role models invests in the lives of these young men who come from low-income homes and teach them different life skills that they can benefit from. As 2021 begins, we are not quite sure what this year has in store for Calhoun and Cleveland counties. But here at the Agency for Substance Abuse Prevention, we do not slow down. In the upcoming year, ASAP hopes to expound on its newly initiated workforce development efforts. Workforce Connections is a collaborative program among community, education, and industry partners designed to provide education opportunities, work, readiness, and employability skills. This initiative includes partners with the United Way, Calhoun County Chamber of Commerce, and the Regional Workforce Council. We are also working with the Homeless Coalition of Northeast Alabama to help provide prevention services to the homeless population we are seeing. In conclusion, ASAP has invested over $500,000 in prevention services in Calhoun and Cleveland counties this past year. If you have any questions or need any substance misuse material, you can call us at 256-831-4436 or visit our website at asaprev.com. And we invite you to follow us on social media. Thank you, God bless, and we hope 2021 is a prosperous year for us all.